My name is Samuel Agyei Wiafe, and the Executive Director for Rare Disease Ghana Initiative. So Rare Disease Ghana Initiative was established as a non-government organization that with the mission to improve the well-being and the quality of life of persons living with rare diseases and their family. And the vision is to be the leading organization for health professionals, researchers, patients, patient organizations, where we are looking forward to be the voice that is leading advocacy and also coordinating care for persons with rare diseases. Our work is focused more on 5 main pillars. First of all, being the awareness and education aspect of it, of making sure that there's enough awareness and education on rare diseases. The other area is in the area of advocacy, working through the health systems to make sure that persons living with rare diseases are matter in our policy formulation and through our social services. They are considered in any other policy that is formulated in Ghana. The persons living with rare diseases are considered. The other area has been in the community empowerment, and so being able to equip families, patients, and the entire rare disease community, the skills, the knowledge, and feeling empowered about the condition and making sure they are well equipped to living with the condition. And the other area has been in the area of support, being able to provide support to persons living with rare diseases directly, indirectly, and their families as well, being able to be in a position to support them and being able to coordinate the support that is available. The final area that we are focused on is also in the area of data research, making sure that there's enough data. So we work with many organizations, many industry, from the industry, from the national and international federations, working with the government, working with academics, working with clinicians, working with researchers. When we work with the families as well, we serve as a multidisciplinary platform that helps to ensure collaboration. For the past years, we have more focused on awareness, being able to create more awareness, and so we've spearheaded the celebration of the Global Rare Disease Day for 4 consecutive times in a row in this country. We have held symposiums, recently had our 3rd symposium, trained medical professionals through collaborations. We are currently running a diagnostic program which is helping patients who need genetic testing to access the genetic tests. We are also building a national registry for rare diseases. We have had few cases of Prader-Willi syndrome reported, and so which is evident that there are families living with Prader-Willi syndrome in Ghana, but there isn't a patient group yet for Prader-Willi syndrome. And so one of our commitments is to be able to support these persons within our Ghana Rare Family Network. So as a national organization, we do say that we are very committed again to everyone living with a rare disease, and specifically for Prader-Willi through our we have a plan to support the community. So we are very, very happy and ready to support persons living with Prader-Willi syndrome in Ghana. Though rare diseases it's a global issue and it affects everybody around the world, and so many people around the world living with rare diseases in low middle income countries, specifically in Africa, and particularly in Ghana, comes with an additional gaps and challenges that families have to face. The first one is that as a country, we are dealing with a double burden of diseases, including infectious and non-communicable diseases. And so our governments are left with no other option to prioritize. And in the area of prioritization, rare diseases are most likely going to be seen as unimportant area of investment. So there's a huge gap in there. The other challenge has been the fact that generally for most Ghanaian communities, we ascribe a lot of spiritual meanings and representations to things that we do not know or do not have much information about. And so living with a rare disease is most likely going to be interpreted as, say, curse or punishment from the gods, or something not pleasing to hear. And specifically having a child or multiple children with the same condition means that it's going to worsen the situation and going to make it worse, as it's going to increase stigma among the persons affected and their families. And so it makes it very, very difficult to actually live in a community, at a community level, to live with a rare diseases, because you go to church and nobody wants to mingle with you because they think that greeting you will transfer the condition to them, or they may have children with similar children, or someone is pregnant and do not want you to look at them because they think that they looking at your child means that their child is going to turn into one with a similar condition. And so these sociocultural issues that exist makes it very, very difficult and worsens the mental health of the family who are affected. And so these are some of the realities of the rare disease community, and that is why our organization is up there. It's up to be able to change or renew some of these mindsets and be able to help change some of these perceptions and beliefs that we have about persons being different, persons living with disabilities, persons living with chronic diseases, persons living with rare diseases, and persons living with unknown syndromes and unknown conditions. People having to come to terms with these. That's why the public needs to be well-educated, well-informed, and about these conditions and the fact that they are very normal. Rare diseases not being just a medical condition, but from a psychosocial point, due to these other additional issues that are associated with it, it becomes more of a psychosocial issue for us to address. And that's why, personally, as a psychologist, I found the need to champion this cause. It it is a normal thing to have someone to have a rare disease, and it is not abnormal for somebody to have a rare disease. It is not a fault of theirs. It's not the fault of their family. It is not the fault of the mother. It is not a punishment of the mother. It's not a choice of the family, but majority are genetic, and there isn't, they inherited it, and we have to accept them, be able to rather support those who are affected, and be able to provide the needed assistance that will equip them to have a fully functional and fulfilled life.